Hey everyone, thanks for joining us. I'm Samantha, and this is transirl. I'm super excited about tonight's episode as it's a really rare glimpse into a procedure that is rarely talked about openly. From the start, the intent of this show has been to educate and illuminate our viewers through conversations with those in the transgender community and those who support the transgender community. Tonight's conversation will be with the latter, and with an ardent supporter of trans people who does incredible work to make people whole. Joining me tonight in the transirl control room is Stephen, who is not only an amazing director of this show, but is also on the transgender spectrum.
Thank you so much, Samantha. We hear from so many amazing people out there, and I think an important part of the show involves exploring the diversity of the community. Tonight's show and all 25 other episodes in this library of transirl has really been an important source of education, inspiration, and identity for me personally. So with that said, it seemed like a good place to kind of come out more formally and let you know a bit more about the one who's pushing the buttons and yelling in Samantha's ear. I hope I can come to the show representing the non-binary people within our community. I just personally am at a point, and it only took 49 years where I'm ready to explore just what that actually means in presentation and in finding a balance and a place of peace for myself. I've been on HRT for the past 14 months. I have a loving and supportive family who is along this journey with me, with all of its moments of fear, and moments of tears, and moments of joy. I'm born male. I do think it's both wonderful, instructive, and interesting to me that I tend to get read as female to male on first glance. I don't think I'm alone with this part, though, as we've all slowed down in this strange stay-at-home world we're in. We've had a little bit of time to just think about what's really important, so I've used that time to kind of turn in a little bit. As I've connected with and heard stories from and worked with many great people in the community, I've had these thoughts of being not trans enough for this job and felt like some kind of phony sometimes. I thought I could just wear my director hat, put on a good show, help and move things along, and then set up for the next one. I found it really difficult to separate the person and the task. But thanks to these same people I met, especially the one in this box over here, who gives so much of herself daily and weekly, I've realized that everyone's journey really is their own and is unique as the person. So I'm going to be sure to keep that in mind as we continue to explore and learn more about myself and all of us. So off my soapbox.
No, it's been an honor to work with you on this show, Stephen, and I'm just so glad we get to work together to make this happen.
Thank you so much.
So as always, Stephen will be monitoring the live chats on YouTube and Facebook. So if you have any questions for our guest, please make sure to submit them there. But let's go ahead and get into this week's show. We're taking a closer look at a procedure that some people may consider as part of their transition, facial feminization surgery. Conversation around any transition-related surgery may be difficult, so please be aware if this conversation is something that may be difficult for you. We're going to be looking at some before and after photos as well. Some of those are going to include results immediately following surgery, but they're not gory. They are still in a surgical setting, so I wanted people to be aware of that. Two more quick notes before we bring our guest on here tonight. Our guest is joining us without compensation, and no one associated with our show has been compensated for our guest. The conversation is presented as a casual conversation and is not intended as medical advice or recommendation of any provider over others. Second point, facial feminization is not a requirement to transition. Each transition is unique and no one is more or less valid than anyone else because of want of, access to, or completion of surgical procedures. Okay, on with the show. Tonight's guest is Dr. Kea Champa. He's an accredited surgical fellow, having studied at Pepperdine University and the University of Texas, and completed training specializing in facial feminization surgery at Boston University Medical Center. He's been practicing aesthetic craniofacial surgery at his offices in the San Francisco Bay Area and Marina del Rey, California, catering largely to trans feminine individuals having facial feminization surgery. He's agreed to join us on the show tonight to share insights into these procedures and to answer your questions. Dr. Kea Champa, welcome to the show.
Great. Thank you. I definitely appreciate you having me.
It's really an honor to have you here. I'm so glad we were able to work with both of our schedules. So let's get right into it here. I wanted to give you a brief moment here to share a little bit about your background, your medical background, and also just a little bit about you personally.
Yeah, so my medical background, I originally studied otolaryngology, which is the study of the head and neck, and then furthered on that study to study craniofacial surgery with Dr. Jeffrey Spiegel. And that's where I learned most of the techniques that I do today in terms of facial feminization surgery.
All right. When did you know in your career that you wanted to focus your attention on facial feminization surgery?
That's actually a very interesting question. I went into medical school thinking that I was going to be an orthopedic surgeon. I only realized at one point that orthopedic surgery was a lot of biocarpentry, and I wanted something a little bit more refined. And then I looked into more finer procedures such as plastic surgery, and also particularly the face is the most intricate part of the body. And that's actually where I started to get my interest, and I had the fortunate opportunity to train in Boston with an expert who was doing facial feminization surgery.
So when we're talking about facial feminization surgery, what is the ultimate goal that surgeons strive to reach as part of these procedures?
The goal is really to create a natural result and also to give a result to a patient so that way they can be gendered in the gender that they identify as. So a lot of my patients are trans feminine. So the goal is to have them be gendered in every setting as their desired gender as a woman.
And I know we're talking about facial feminization surgery as a whole, but that's really an umbrella term. There's actually many different procedures that kind of fall under what facial feminization is. So if you could you walk us through what some of those procedures are and what they accomplish?
Well, I think the best way to think about the face is to divide it into three parts. A lot of those procedures sit in those areas. For example, I like to divide the face to the upper face, mid face, and lower face. For example, when we look at the upper face, one of the first things that we look at is the hairline. The height and shape of the hairline is very important in terms of femininity and masculinity. Obviously, if the hairline is too high, that can give a more recessed hair appearance. Also, if the hairline is too low, it may not be ideal. So we try to reposition the hairline in an area that is appropriate for your desired gender. Typically, for most women, the hairline to brow distance is about 6 centimeters. So we strive for that. For example, this before and after, her hairline was obviously was much higher than it should be, so we brought that down. For some patients, when their hairline is too low, we actually raise the hairline, which sounds counterintuitive, but having too low of a hairline also can masculinize the face. So there is kind of a specific area where the hairline should sit in terms of your gender.
Now that's interesting. I had never considered that it could be too low. So we are talking about the upper face here. Besides hairline, you also brow work is also or can also be a part of facial feminization surgery as well.
That's correct. So the next part after assessing the hairline where it should be is to assess the brow. For many masculine for men particularly, there is a really large brow ridge. This actually is a 3D model that shows the brow ridge here. For feminine women, the brow ridge really is not pronounced at all. So these procedures are geared towards removing the brow bossing. Look at this model here. You can see this area that is shaded. This is an area where the bone is thin. In terms of the surgical procedure, it can be quite complex to perform in that the bone here is quite thin, so it's very difficult to reduce that just by a shaving technique. For the most part, in order to reduce this all the way, this requires a craniotomy where this part of the bone here is cut out. It's reshaped and then pushed back to more feminine shape. And then the other procedures that are performed are reducing the prominence of the brow ridge, which you can see here. And that is typically either shaved down or reduced so that way the eyes appear larger.
Okay, coming down from the brow, then we have the mid face. And what type of procedures are available to feminize the mid face?
So this is an interesting area where this is where I typically recommend patients to be on hormones for about 2 years before considering facial feminization surgery. It's not a requirement. We don't gatekeep where you have to be on hormones for 2 years in order to undergo surgery. But this actually is where hormones has a really significant effect. Hormones tend to augment the cheek and malar area. Women really do have a really full upper cheek. I think a great example is Samantha. You can see from being on hormones for extended period of time, she's got quite a bit of augmentation in that area. So one of the features that we perform if hormones does not augment the area enough is to augment that with either fat grafting or some type of cheek implant. Naturally, estrogen actually causes that area to hypertrophy, and fat redistribution of the face for more feminine appearance. As you can see with Samantha's before and after, from my understanding, you haven't had any facial feminization surgery.
No facial feminization, but I have had a rhinoplasty, so I want to be upfront about that. I have had nose work done, but the gains in my cheeks are definitely results of the hormones, and some of the facial structure and fat redistribution in the face has all been from hormones up to this point.
So yeah, I definitely want to stress that hormones does significantly affect femininity of the face. It changes the fat redistribution. It also actually removes or makes the muscles less pronounced. Definitely muscles around the forehead, muscles even around the jaw. It can make the jaw appear smaller. Going back to the mid face, the primary procedures that we perform are some type of augmentation of the cheeks, which could either be fat grafting or a submalar implant, which you can see in the picture there. It's very important to know exactly where to place it. Really, the area that is most feminine is going to be the area right below the eye, which is called the submalar region. There are other parts where higher along the arch, which is along the zygoma or zygomatic arch. Augmenting that area actually can masculinize the face. So it's very important to know exactly where to augment.
It seems like a lot of these procedures are just a matter of, micrometers or millimeters in a lot of cases, the difference between a masculine leaning face and a feminine leaning face. Another area you do and specialize in is jaw work. And I think you're using some really interesting tools today with the work that you're doing there.
Yeah, for jaw surgery particularly is very complex. There's a lot of things. So this is a jaw model that we use. So obviously you could see the tooth roots. You could see an outline actually of the nerve that provides sensation for the lower lip. So we reduce the jaw. Those structures are somewhat at risk. So in order to minimize the probability of injury to those things, we do 3D print jaw models. So that way we can use that intra-op. So that way we can make sure that we don't damage tooth roots, and we also do not damage any nerves. One of the big gender markers really is the differences between a male and a female jaw. A masculine jaw tends to be wider and also tends to be longer and more angular. These procedures are designed to soften the jaw angle and also reduce the chin height and width.
Yeah, I think that's incredible. And, as with any medical field, there are many new tools and techniques that are being introduced. You mentioned that you're using 3D printing now. What are some of the other new tools that you're using and that you're seeing other surgeons use in order to perform implant surgeries?
So one of the tools that we use to minimize injury to soft tissue are ultrasonic bone cutting tools. Before, we would use a traditional saw, very similar to the type of saws that you would see, for example, at Home Depot. So those saws are they're non-discriminatory, meaning that they can damage soft tissue and bone. These ultrasonic bone cutters are a little bit safer in that it targets only bone. So as it comes contact to soft tissue, there's less issues in terms of soft tissue injury. So that's definitely one advance. The second advance that we also use is image guidance during surgery, where we have a device that's similar to GPS, and it allows us to know exactly where we are in the craniofacial structures as we're performing your surgery. This can be helpful around the skull, particularly when you're doing brow work. This just has allowed us to perform the surgery with a little bit higher precision.
All right. One thing I did want to ask you, outside of your cosmetic work, you're also doing some amazing nonprofit work overseas. Do you mind sharing a little bit about what your experiences have been over there?
Definitely. I was actually born in Laos. I came to the United States as a refugee. So as part of finishing my training, I have been going back to the country of my birth, Laos, to do craniofacial surgery and reconstructive surgery. So the first 5 years of my practice, I was a yearly trip where we treated cleft lip, cleft palate. We also perform head and neck surgery and reconstructive facial surgery. It was a way to really give back to country that I was born in.
I think that's an amazing gift, and full that you're able to work that into your schedule. Such an amazing thing for those people who need those surgeries. And, we can call cleft palate repairs cosmetic, but I'm going to put that in quotation marks because that's life-changing for people who were born with those conditions. So I think that's wonderful that you're able to dedicate your time, resources, and talent to helping those individuals, especially in your home country.
Yes, I mean, for a procedure that takes about 10 minutes, or 10 to 30 minutes, it's definitely a life-changing procedure.
Absolutely. All right. We had, I think, a record number of questions submitted for this week's show, so I do want to get into those. If you're watching live on YouTube or Facebook, you can throw questions into the chat for Dr. Kea Champa or myself. We'll try to answer as many as we can, but we are trying to be very aware of how much of Dr. Kea Champa's time we're taking up here. So we're going to start with questions that were submitted earlier in the week through Instagram. And the first question that was submitted is, what do you recommend for somebody with keloidal prone skin seeking surgery?
So there's several things you could do to hopefully prevent keloid formation. One is during the surgery, right after performing it, is to inject steroids into the incision. Then what we'll do over the course of the next 4 weeks, weekly, we inject also steroids. Steroids are anti-inflammatory medications, and that has been shown to decrease keloid formation. It's important to know where keloids actually form. Keloids rarely ever form on the face. Keloids typically form really on the ear and then the neck. Definitely they can occur more often in the chest and extremities, but keloids are actually extremely rare around the eyelids, the upper and lower face, particularly just really around the ear and the neck is where I see most of keloid formation.
Yeah, that's important to realize. I had no idea that the face was less prone to those type of scars. Next question that we had here, maybe this is a loaded question, I don't know. Are there any other surgeons you recommend or whose work you respect?
I think there are really a lot of great, surgeons out there. By the time that most patients see me, they've already have done 4 or 5 consultations with, various surgeons. So, I train with Dr. Jeffrey Spiegel, so I have a lot of respect for him. I also, by the time I do my consults, a lot of my patients have seen facial team in Spain. They may have seen Harrison Lee. They also may have seen Deshans Braley. And then a lot of other trainees that had trained with Dr. Spiegel, for example, Dr. Vartan Marderosian. We have Dr. Brian Rolfes, Sarah Saxon, Jeffrey Jamali. So there's a lot of people that have trained with Dr. Spiegel.
And I think you touched on something important there. Is with any surgery, it's in the individual's best interest to get as many consults or reviews before deciding on a surgeon. I think that's beneficial and allows people to make the best decision possible for themselves.
Definitely. I typically encourage patients to do at least 3 or 4 consultations to really get an idea of the different various procedures also to do your own research and make sure that you have some type of personal connection and are comfortable with your surgeon.
Absolutely. All right, next question here. In light of the COVID-19 pandemic, will you still be performing surgeries this year?
Definitely. So once we're allowed to and it's safe, we will resume surgery. So one of the things that we were doing today was really prepping our team in order to return to performing surgery. So we were working on protective equipment for our staff, protective equipment for our patients. We're working on possibly providing testing for coronavirus either a couple of days before or on site before your surgery. So we're doing everything possible to make sure the surgery, when it does resume, it's done in a safe manner and also in a very controlled way where we can minimize the amount of issues or infections or complications.
I think that's awesome. Next question here is a really great question, and it really gets to the heart of a lot of people's internal struggles with their appearance, dysphoria, and the decision whether or not to, decide to have facial feminization surgery. And the question is, how does culture affect what women should look like, and who decided or who decides what women look like?
During my consults, a lot of the results are really driven by the patient. So there are unique things that you have to take in account. For example, certain individuals, for example, if you're Jewish, you may have a characteristic Jewish nose, and you may want to preserve that. If you're African American, you may have a very particular appearance in terms of your nose, and those things you may want to preserve so that way you don't lose either your ethnicity or your unique features that you have. Ultimately, the final result really is driven by the result that you want. I can only provide recommendations, but ultimately the patient will decide what results that they want.
And I think that's important to keep in mind, right? That you're here to help someone achieve their ultimate goals. You're not there to tell them what they need to do. And everyone's needs may be different than the person before them's needs.
That's absolutely correct.
Yeah. Next question from Instagram. Are you seeing more cases of FFS being covered by insurance?
Definitely. I think that a lot of it's really driven by various companies that are trying to attract the best and brightest. For example, most of the technology companies in the San Francisco Bay Area do cover this procedure. And I think it's really because not only are they wanting to support the community, but also they're trying to attract the best and brightest to their company. In terms of my patient population, I would say the majority of my patients have some type of graduate degree. I recently did a consult with a patient who has PhDs from MIT and Caltech. We have a lot of engineers, computer scientists, and these companies, again, are really vying to get the best and brightest. Also, for example, Starbucks came out with a policy last year that they were going to cover gender confirmation surgery for all their employees. So a lot of this has been driven by various companies, again, trying to attract top talent.
Yeah, I think there's been a lot of progress. I've seen progress. I've heard of people who just in the last 12 to 18 months now have access to FFS and some other procedures that they didn't have access to before. But I know, and I know at my current job, FFS still is explicitly not covered. And there are still, a lot of hurdles to overcome for a lot of other positions. And I think what's unfortunate is that a lot of tech jobs, higher paying jobs, do have that option, but I'm seeing a lot of working class people and, educated people, teachers and people who are working in businesses across the U.S. that still don't have access to FFS. So I'm hoping that tide continues to shift here. But I'll take what we've gained. There's a lot more to go.
Yeah. I think definitely it's the tide definitely is turning towards that direction. the main battle initially was coverage of bottom surgery, and I think for the most part that has been universal. So I think facial feminization surgery definitely will go along that route. So again, there are definitely a lot of insurance plans that do cover it, and the most common indication really is the company that you work for, because they have specific policies designed to cover their employees. We definitely even had some patients where this was actually not in their policy, but they petitioned and was able to put that onto their insurance policy.
And I have seen that as well. I know people personally who have fought for FFS coverage, and they've achieved it. So that is possible. All right. Let's look at our next question here. What question should I ask when searching for a doctor to do FFS revisions? So that's kind of an interesting question.
So FFS is technically very challenging. And then when you're adding revision surgery, it is even more complex. One of the reasons why we started to use 3D planning and 3D models, 3D printing, was we were seeing a high number of revision cases. So in order to maximize our chance of success, we wanted to be able to practice the surgery multiple times and be really ready for the surgery day. I think practice and also preparation increases your chance of success. It's important that when you're seeking revision surgery that you seek a very experienced surgeon. I would say the first couple of years of my practice, I refused to do revision surgery just because I did not feel that I had the skill set at that point to tackle on these more difficult cases.
Yeah, that's interesting that you're aware of where you were at in your career and made that choice then. How often do you see people coming to you for revisions now?
I would say it makes up about 20 to 25% of my practice. A lot of times it's not really the fault of the other surgeon. I think sometimes the patient may not have really expressed the exact result that they wanted. So that maybe could have been some miscommunication with their surgeon and the patient. So there's really definitely many reasons why someone would seek revision. It could have been that the result that they were seeking wasn't what they received. So there's many factors involved with that.
Yeah, I would imagine it's very personal what someone chooses or chooses to not adjust in the future if they decide for that revision. All right, let's take a look at the next question here. Are results usually as dramatic as people hope?
I think it depends on where you start from. For example, if you have a very large brow bossing and your anatomy is conducive to it, you could significantly reduce the brow bossing, and that creates a very dramatic appearance. Same thing also with the jaw. If you have a very large jaw that's very prominent and angular, you can make a very dramatic change. Obviously, if you start off where, for example, there's some individuals once you start hormones, their face obviously becomes very feminine. So it's really difficult to make a dramatic change when there's really not as much work that can be done to make those changes.
And I guess it depends really on what the individual is looking for as well. I think there are probably just as many people that are looking for dramatic results as there are people who are looking just to finesse and really show their natural qualities as well.
That's correct. Most patients really still do want to look like themselves. They would like to look like their sister or their mother. So someone, still related. So they still want to maintain who they are, but just the feminine version of themselves.
Yeah, I think that's a good way to look at it there. Last question from Instagram. And this is sort of one we talked about a little bit already, but are considerations made for faces from different ethnic groups and backgrounds?
Definitely. Rhinoplasty definitely is an area that requires a lot of finesse. So that way you have the nose that fits the face. For example, if you're of Jewish descent, you may not want to remove all the hump of the nose. Also, if you're African American, you may not want to make the nose too small. So we do try to pay attention to the ethnic differences and try to preserve that if that's your goal. Obviously, I have some patients that want to remove that completely, and that's also a possibility.
Does that show in any other areas of the face as well, where people might want to preserve, or other ethnic considerations need to come into play?
The jaw, definitely. So Asians in particular tend to have a little bit wider face. And then definitely differences in the chin. So you try to tailor that as much as possible to their ethnicity.
All right. And with that, I think we're going to head over to our live chat questions. I know we've got a couple of them that have come in during the show here. So let's pull up the first one there. Does he recommend plumping the upper lip by shortening the distance between the bottom of the nose and to the upper lip? And this is something we didn't really talk about in the show so far, but the distance between your upper lip and your nose is definitely something that may be perceived as a feminine feature.
Definitely. So on average, if you measure the fulcrum distance, which is the distance between the base of the nose to the upper lip, and most men, that distance is about 20 millimeters. For most women who are in their 20s and 30s, the distance is shorter. It's typically around 12 to 15. So when we perform a lip lift, it's really to emulate that. This is something that we perform for trans feminine women, but also older women. What happens as you age, the distance elongates. So performing that not only makes your face look more feminine, but also makes you look younger.
Okay,
it also
so now
helps
after
to
the
improve.
episode, what was that? Go ahead.
So it's really important also for women to have nice upper tooth show. Dentists are actually really great in terms of identifying this, but most women, just that rest, meaning that they're not closing their lips, will have about 3 or 4 millimeters of tooth show. That's a sign of femininity and also youth.
See, now after tonight's episode, I'm going to take a ruler to my face. You realize that, don't you? All right, let's get to the next YouTube question here. And this is a question around scarless trachea shaves. And the question is, are these only done in conjunction with chin or jaw surgery, or can they be done on their own?
They definitely can be done on its own, but I'll just provide one caveat. So I tend to do this combined with jaw surgery for several reasons. It's because when you're doing transirl or scarless trach shave, you've already have made that same exposure as if you're doing jaw surgery. Also, it just makes the access easier. And you're already going to have chin swelling, so it's not that much extra downtime to have also neck swelling. If you were to have a scarless trach shave by itself, you're going to have a lot of jaw swelling and chin swelling, even though you didn't have jaw surgery. And the chin swelling particularly can last 3 to 6 to 12 months. So I think a lot of patients may not like the idea of having chin swelling when their main procedure that they wanted was tracheal shave. Hopefully that makes sense.
Yeah, definitely something to keep in mind when you're having a procedure done. All right, our next question. Well, this is interesting. Is there such a thing as facial masculinization surgery?
Definitely. That is a smaller part of our practice, mainly because most trans-masculine patients, when they undergo testosterone hormone replacement, often it masculinizes the face enough where they're not seeking surgery. But we do have some patients where they're wanting brow augmentation, jaw augmentation, and procedures to masculinize the face, like augmenting the nose. And then there's also a procedure to recreate an Adam's apple. But those surgeries are less common, as most transgender men hormones does a really amazing job of not only masculinizing the face, hair growth, but also it helps to lower the voice. What's interesting about trans feminine patients who undergo hormone therapy, voice is not improved. But if you're a trans masculine man, testosterone actually will lower your voice with just hormone therapy.
Yeah, it's definitely one of the. I mean, it's a very telling thing for somebody in transition. You know, voice and how voices change for trans masculine individuals who are on testosterone. That's a very clear tell of someone presenting masculinely. Whereas trans feminine individuals, you don't get the same change from starting estrogen. And there are options to change the voice, but those are usually vocal training or vocal surgery. One question that I saw come up here in the chat was around hormones. I know that you had mentioned earlier in the chat you don't normally, you don't gatekeep, you don't keep someone from having a procedure done due to someone's time on hormones. But is there a time you'd like to see someone on hormones to make sure that those facial changes have happened before undergoing surgery?
Yeah, the typical time period is about 2 years. Hormones, in terms of the effect, the face will plateau about 2 years. Typically, if you're on hormones about 6 months, not much has changed. The effect of hormones on the face typically start about a year. And then you'll see really significant improvement over the next year and a half. Then at 2 years, will plateau. And 2 years is a good time period to consider facial surgery, since we know that the facial changes really won't improve much with further hormones.
Yeah, I know that picture I shared earlier, that before and after shot, that was actually taken on the 2-year anniversary of when I started HRT. And I will say though, yeah, between starting in year 1, there were some facial changes, but between year 1 and year 2 is actually where I saw the majority of those facial changes happen. And even, you know, as I'm now over 3 years on HRT, I have seen additional facial changes, not as much, but some. But it did take the full 2 years to really see those changes in myself. So I went from somebody who was, you know, generally considering FFS early in my transition to someone who generally doesn't consider it at this point, because I'm happy with the changes that I've seen in my own journey.
Definitely. I mean, that's actually why we recommend, if possible, to be on hormones for 2 years. So that way you may be able to avoid some surgeries that you maybe considered originally.
Mm-hmm. All right, let's go to our next YouTube question. Is there an age that is too old for facial surgery?
Definitely not. It really comes down to your health status. We definitely have done surgery on patients in their 80s. There's really there's never an age that's too old to really to transition. Back in the early 2000s, I mean, our average patient actually was around 50, 60. Now we're seeing a lot of younger patients now more recently, but definitely there's no age limit in terms of transitioning.
I think that's incredible. And I think it's amazing too. And it's wonderful that people of all ages are feeling comfortable and coming out and taking those steps to be their true selves. And it's fantastic that you're able to support those individuals who are looking for surgery, even in their 60s, 70s, 80s. That's incredible.
Yeah, they say age is only a number, right?
I just had a birthday, so I'm going with that. Age is just a number. All right, let's look at our next question here. Is there groupings of surgeries to suggest, oh gosh, hold on, I got to translate this question here. Are there groupings of surgeries to suggest together, like eyes or nose, or is it possible to do multiple things at once?
So we really have two groups of patients. One group really wants to have the whole transformation performed in one surgery. And that type of patient, we actually perform surgery for about 12 hours. We work on the hairline, the brow, nose, cheeks, jaw, and neck. And another group separates out their surgeries. I think the easiest way to separate the surgeries is really focusing up the upper face at one set of surgeries, and then focusing on the mid and lower face in the second set. I think it's important to also understand the recovery of these surgeries. For example, anything in the upper face, the brow, tends to have a quicker recovery. Even though the cranioplasty we had discussed before seemed like a highly invasive procedure, it actually is a very easy recovery. There's not a lot of pain or discomfort. And most patients actually will look fairly normal within 2 weeks, meaning that you can go out and have dinner in a public space and people would not really be able to tell you've had surgery. The lower face and jaw surgeries are different. Jaw surgery, there's significant swelling that occurs after. So it is going to be quite apparent that you've had surgery for several weeks. It's not going to be closer to a month that you will look more normal. So for the type of job that you have, how much downtime you have may affect if you separate your surgeries or have it all at once.
Okay, so I have to ask you, and this isn't in the YouTube, this is just from me, but how do you prepare for a 12-hour surgery?
It's interesting. I've been doing this for so long, 3 times a week. I typically operate on Monday, Wednesday, and Friday. So a lot of it is just stamina building. I think it's very similar to someone who runs marathons. You start kind of slow, and then you get to a point where you could do long stretches of time. But that's something that we routinely do. Operate. Yeah.
Yeah, that's incredible. All right, let's take a look at the next question here. How long would a person need to arrange for post-op healing accommodations if they travel from out of the country to have a procedure done?
Typically, most of my patients stay in town for about 8 days. So obviously, if it's very extensive surgery, we provide post-op accommodations overnight with a nurse to make sure that you're safe. And then most patients will stay in town for about 8 days. At the 8-day mark post-op, we remove sutures, staples, and then you're allowed to fly back home. That also applies to our patients who live internationally. We usually have patients who come from the UK, Germany, Australia, and most stay in town for about 8 days and are able to leave after that.
Not too bad overall then. All right, let's look at our next question. How long is the healing process? So it kind of ties into the last question there. How soon does the patient see their new look?
Well, the final results take about 12 to 18 months. So it's important to know that it does require some patience. But in terms of fastest healing, I would say that it would be the forehead. So I tell most patients at about a month, they will see the final result of their forehead. So there's really not a lot of swelling that occurs there. Areas that take longer are obviously the nose. That can take anywhere 12 to 18 months to see the final result. Same thing with the jaw. That is an area that requires a lot of patience. Jaw surgery causes a lot of swelling, particularly underneath your chin. So you may feel that you have a double chin for several months. Typically, those procedures, what I tell my patients is, for example, the nose and jaw, I typically tell them at about a month, they'll lose 50% of the swelling. At about 3 months, they'll lose about 70%. And then the last 20, 30% really takes 12 to 18 months. So it really depends on the procedure.
Yeah, there is a procedure-specific question that just came in here about how long after rhinoplasty do you have to wait before you can wear glasses?
We typically recommend about 4 weeks. The reason for that is a lot of times with rhinoplasty, we perform something called an osteotomy, where we break the bones in this area here. This allows us to make the nose more narrow or reshape the bone. It takes about 4 weeks for the bones to heal and set. Typically after 4 weeks, it's really hard to displace those nasal bones. And that's why wearing glasses at that point is safe.
And there was another quick question here around the timeline for recovery for a trach shave.
Trach shaves have really actually minimal recovery and downtime. Most patients will return back to work within a couple of days. Obviously, if you have a scarless trach shave, that's a lot more downtime because it requires a lot more surgical dissection versus if you go externally, there's less dissection, so less downtime.
And going back to seeing the final results, and with any procedure, where you're having surgery, where someone's cutting into it takes time. And I know just from my rhinoplasty that it took me, it was still adjusting for up to a year after surgery for that final swelling to go down. And it can be hard. It can be hard to wait. Do you ever get like frantic calls from people that are like, "Oh my gosh, I've got this swelling. It doesn't look right," and you just have to remind them, "Give them time."
I think we spend a lot of time in the preoperative process to really explain what to expect. But even at that, though, we definitely get our frantic calls of some swelling that they're concerned about their nose, their jaw. So that's pretty common. The good thing is, we could show our patients pictures of prior patients that shows the progression of the swelling and it decreasing. And really, just reassurance is really that's all that's needed most of the time.
That and just waiting it out, right? Just got to wait. Let the swelling subside. All right, let's take a look at our next question here that was submitted. Are there any more? Maybe we got to the end. I don't know. Oh, we got to the end. Oh my gosh. Okay. Well, wow. That is incredible. I'm just checking the chat here really quick to make sure I didn't miss any other questions. But I think, gosh, we got through so many amazing questions here tonight. Let's see if there's anything else. Just give it one final check. I think we covered them all. This has been really a wonderful chat, Dr. Kea Champa. I really appreciate your time here. I think that for a lot of people, surgeons are kind of inaccessible at times. And I know that with this pandemic right now, this kind of allowed your schedule to be a little bit more open than usual. It's not great that people are having to wait for surgery, but I am glad that we were able to take this time today to answer some questions and, discuss the procedures. So thank you so much for your time.
Well, thank you. I definitely appreciate you having me.
All right. As we wrap up the show here, I did want to remind everyone watching out there that if you are not currently subscribed on our YouTube channel, please go ahead and give us a click there on the subscribe button at transirl. If on Facebook, if you're watching us over there, you can follow us on Facebook and get notifications when we go live at transirl show. And on Instagram, we will post updates to our schedule and opportunities to ask questions before showtime there at transirl. So all opportunities for our watchers out there tonight to participate in the show and stay up to date on what we're doing here. So we'll bring everyone back on here together. Dr. Kea Champa, again, thank you so much for your time. I think it's absolutely wonderful the work that you're doing out there. It's amazing to see the latest in improvements in facial feminization surgery. And I'm really hoping that in the very near future, you're able to get back to doing what you do best.
Definitely. Thank you. Thank you for having me.
Thank you so much.
So from all of us here at transirl, thank you so much for watching, and we will see you next time. Everyone have a great evening. Thank you so much.